and the broader constituency. Tonight's topic, as you know, will feature a variety of issues related to Bayview Hunters Point and the cleanup of the toxic nuclear site there at Bayview Hunters Point. I don't want to take too much time because we have a full plate of panelists tonight. And so I'm going to move quickly to doing brief introductions of our panelists. But I do want to say that if you're interested in learning more about San Francisco Bay Physicians for Social Responsibility, please go to our website and the link for our website will appear in the chat. Also, as we go along, if you have questions for the panelists, please save them up to the end of the webinar. We've reserved 15 or so minutes at the end for you to learn more, to pose questions to each of our panelists or to them as a group in reference to tonight's issue. So without further ado, let me just tell you a little bit more about our panelists and read their brief bios. So Annemarie Charlesworth is director of the UCSF Earth Center. I'm on the advisory board of that center, so I know it's just opening up. Prior to the founding of the Earth Center, Annemarie was the Associate Director of UCSF's Environmental Health Initiative and Associate Director of the Clinical Outreach and Engagement Core of the UCSF Pregnancy Exposures to Environmental Chemicals Children's Center. That's PEAK, I guess. Our next panelist, who hasn't joined us yet, I don't think, but will be with us soon, is Dr. Kim Rhodes, who's an associate professor of epidemiology and biostatistics and director of the Office of Community Engagement at the University of California, San Francisco. University of California, San Francisco's Helen Diller Family Comprehensive Cancer Center. She's partnered with San Francisco Bayview Hunter Point residents to conduct research and develop community-driven solutions to address the hazardous exposures and health inequities faced by Bayview Hunters Point's residents. Daniel Hirsch is the president of the Committee to Bridge the Gap, a nuclear policy NGO, which he founded nearly half a century ago. He retired in 2017 as director of the program on environmental and nuclear policy at the University of California, Santa Cruz. And last, but certainly not least, Michelle Pierce is the executive director of the Bayview Hunters Point Community Advocates. If you'll look on our website, you'll see a very informative link to an interview with Michelle Pierce. And I want to add that she's been a close community partner of the San Francisco Bay chapter of PSR for a number of years. And we're very proud to be partnering with her for over this time. So we're going to start with the first panelist, and I'm going to ask if you're not speaking and you're one of our panelists, if you'll just put your video on dark and then turn it on as we get to you. And again, for our audience, if you'll save your questions or place your questions in the chat as we go along, we'll get to as many questions as we can at the end of the presentation. So having said all that, I'm going to turn it to our first panelist, Annemarie Charlesworth. Thanks, Annemarie.
Thank you so much, Randall. Can everybody hear me okay? And I think you can probably see my presentation. Looks good. Okay. Thank you so much. It's a pleasure to be here with you this evening, and thank you for that lovely introduction, Randall. Yes, we did finally get funding for the Earth Center after 3 years. It was quite a birthing process, and we officially launched on September the 14th. And I will share more about the Earth Center a little bit later in this presentation, and tell you more about where we currently are in my title with engaging the Bayview Hunters Point community to inform environmental health research and education agendas. But I really want to start first with how our collaboration began and give a little more history. We're clearly at the very beginning of our work together, but I think the process is an important one, important part of the story, part of looking back, kind of taking stock of where we are and thinking about how we're going to go forward. So I'm going to start with a brief overview and some history. For those of you not familiar with the Bayview Hunters Point community, the Bayview Hunters Point is a low-income, historically African-American community located in the southeast of San Francisco, within a few miles of UCSF. The neighborhood and residents have been disproportionately and cumulatively impacted by many stationary and mobile pollution sources, including toxic contamination and development work at the former Hunters Point Naval Shipyard site, which is a US EPA designated Superfund site, the former PG&E Hunters Point Power Plant, the Southeast Sewage Treatment Plant, and many underregulated and unregulated polluting industries, diesel freight transport, and 2 highways. The community has increasing unanswered concerns about how all of these environmental exposures may be contributing to chronic conditions and disease such as asthma in children and adults, COPD, and cancer, which are very prevalent in Bayview Hunters Point residents. And they have been increasingly wanting healthcare advice and research that will help them answer these questions and reduce exposures. My colleagues will be providing additional details about the history and more of the exposures, but the one thing I do want to note is that historically UCSF has done research that has also harmed the community and hasn't engaged the community around environmental health, which has led to understandable mistrust. So our engagement, and at the time it was the Environmental Health Initiative, or with the Bayview Hunters Point, started in 2018 when a patient advisory board member of the Southeast Health Center reached out to the UCSF Center for Community Engagement seeking help with environmental health. Specifically, they wanted environmental health education for the clinic staff so they could answer the community's questions about potential exposures. They were also interested in bringing environmental health medicine to the clinic so that evaluations could happen on site and not at Mount Zion where they currently happen, which was difficult for community members to access. My colleague and I, Dr. Bob Harrison of UCSF Occupational and Environmental Medicine, met with the clinic director, Dr. Keith Seidel, who was very supportive and interested. And we provided one kind of general seminar on various common environmental exposures to the clinic staff, mostly focused on lead and mold. After that initial talk, we followed up by writing and rewriting another proposal to SFDPH to support this deeper, longer-term environmental health work, but it never got funded. At the same time, we were also beginning to write the Earth Center grant. And just to back up, the Earth Center, this mechanism is it's an NIEHS, National Institute of Environmental Health Sciences, center grant, which provides infrastructure support for environmental health. And in that grant, I was proposing some of the work that we had proposed to do at the Southeast Health Center. So our engagement with the Bayview Hunters Point community continued to grow, as did our research team, which included Bob Harrison, Patrice Sutton, Bob Gould, Dan Hirsch, and Kim Rhodes. And we were being asked more regularly to provide some scientific advice and support. We began talking more with Michelle Pierce, the executive director of Bayview Hunters Point Community Advocates. And we started to understand the challenges and needs of the Bayview Hunters Point community from her perspective. Beginning in January of 2019, we began attending Hunters Point Shipyard Citizens Advisory Committee meetings. And we started learning more about the contamination and radiological studies that have been conducted, the Navy's contradictory position on background testing, subsequent updates of their evaluation of the soil, and ultimately the conclusive summary of a UCSF UCB review of the radiological testing. And at these meetings, we were often providing comments and posing questions to the presenters based on our clinical and scientific expertise. As we began working together and learning more, as we began working together and learning more about each other, new opportunities for collaboration started to emerge. Not new resources yet, but new opportunities. And we began to see how we could potentially leverage the resources we did have to advance some of the Bayview Hunters Point's environmental health goals. So one of UCSF's unique assets, if you weren't aware of it, is our industry documents library, which was founded with the initial set of tobacco industry documents. And that's been used successfully by researchers, lawyers, and policymakers to sunshine what industries knew about their products like tobacco, how they manipulated or covered up the science, and public opinion to put profits over public health. Well, I oversee the chemical industry documents collection. And we're always interested in adding important collections to make them available to the public. And so I think it was, the history is, you know, it feels like so long ago now, but after talking with Michelle about documents she had been collecting regarding the shipyard remediation and cleanup, Kim suggested we put them safely up on the industry documents library and make them publicly accessible. And in June 2020, just this past June, Bayview Hunters Point community advocates donated them to the industry documents library. With some, and both the Earth Center and the Cancer Center provided support for making them, uploading them, archiving them, and making them accessible. So also around June, we learned that we were finally going to be funded to launch the Earth Center. Officially, the overall goal of the Earth Center, which means Environmental Research and Translation for Health, that's Earth, is to accelerate the pace of recognizing and preventing environmental exposures that affect reproduction and development to improve human health across the lifespan. Basically, there are 4 directions that we focus on. One is creating new opportunities in environmental health research, making them much more transdisciplinary, and nurturing a network of transdisciplinary collaborators, mentoring and growing the next generation of researchers and clinical leaders in environmental health, finally embedding environmental health literacy within healthcare. Our target audience, based on what we've done historically and where we've had the most successes, has been our community is health professionals and medical students. So we're working at that intersection of people who are working directly with community and seeking to give them the information, training, resources, and support they need to have those conversations with their patients. So the Earth Center Community Engagement Corps is a unique component of these grants. All of these center grants are required to have a community engagement corps. And our community engagement corps essentially ensures that, that our research reflects community needs. So it's the needs of the medical students and practicing health professionals, medical meaning nursing too, but students. That research is translated and disseminated back to the community, and that we create an evidence base that can then be used for education, outreach, and advocacy. So this is an example, a diagram of kind of the mechanism of the Community Engagement Corps. You can see that on the right-hand side. The Community Engagement Corps works directly with a stakeholder advisory board, which represents and guides the Earth Center's mission. It's essentially our heart and soul. The cores that you see, and you can see on the left that the Stakeholder Advisory Board represents a lot of different people who make up that population: clinicians, medical students. I can go on. If you looked on the right-hand side, you can see that the Community Engagement Corps, well, the cores are designed to support research and translation, remaining informed by our community of healthcare students, professionals, and the patients, particularly our most vulnerable patients and populations. So the idea is to foster a multi-directional communication and accountability to our stakeholders. I'm just going to briefly show you our Stakeholder Advisory Board. Randall, right front and center, he said he is on our Stakeholder Advisory Board, and we're very grateful to him for agreeing to do that. I'm going to go through. Judy Young is, she is the director of the National Center of Excellence in Women's Health and the co-director of the Black Women's Health and Livelihood Initiative. Michelle Pierce, also presenting on this panel, is the executive director of Bayview Hunters Point Community Advocates. We have Chanel Williams, who is the director of the Preterm Birth Initiative Community Engagement. We have Alex Trope, who's a resident in psychiatry at UCSF and also did most of his training at UCSF, very involved with climate and environmental advocacy, as well as fresh about what the learning and educational and research clinical needs are. And then we have Karen Pierce as well, who is a longtime ally of UCSF, and she's been very instrumental in helping us navigate and learn about community partnerships, and she is currently with the San Francisco Department of Public Health and Environmental Justice. We also have a Student Advisory Board, which guides both the Earth Center and a newly forming Climate Health Center. We are engaging them to really help us understand and create research, education, and clinical opportunities for UCSF students, as well as increased community collaborations, as they don't really get long-term community collaborations through the program currently. And we currently have about 15 medical students, and it's growing. So the Community Engagement Corps has a couple of projects aimed at increasing environmental health education, training, and tools for health professionals. When we first wrote the Earth Center grant, we proposed conducting a needs assessment with the clinical staff at the Southeast Health Center to better understand their knowledge, skills, and environmental health, which we had intended to then use to inform creating or adapting trainings and tools or materials that we would then pilot, evaluate, and potentially share with other communities. But a lot changed in 3 years, not to mention the last 6 months. COVID, environmental injustices, systemic racism have all amplified the disparities and inequities we knew existed, but we weren't really addressing. So after regrouping with the director, Keith Seidel, and getting feedback from his staff, we are now planning on doing more listening with the clinic staff, the patient advisory board, and the community to hear their concerns and collaboratively develop a plan about how we can best support their needs. And this is all happening now, so it's very exciting. We're also currently supporting medical students partnering with the Bayview Hunters Point community advocates on environmental and climate health projects, including intergenerational mentoring between high school undergraduate students, the medical students, and the Southeast Community Council. We are working on collaboratively creating some internship and training opportunities to advance the community-based projects while also providing the medical students with longer-term community experiences so they can really understand the community and build relationships. And concurrently, we are working to integrate environmental health education and environmental health screening in our clinical education at UCSF. In addition, we just received, like 2 weeks ago, $25,000 from a very generous donor to create a community-based training so that the Bayview Hunters Point community learns how to research and use the Bayview Hunters Point community advocates documents in the library for their own policy advocacy. So we'll be creating that training collaboratively and with Bayview Hunters Point community advocates, and that'll be launching, we expect, sometime in the next several months. And then finally, we're continuing to find more opportunities to support community-led research using the Earth Center Community Engagement Core as a link to the resources and infrastructure that's now available to advance the environmental health science and help communities use this evidence base to advocate for policies that protect their health. And with that, I'm going to conclude my talk. Thank you.
Thanks, Annemarie. We're going to hold questions for later, so we're going to turn to Dr. Kim Rhodes and ask her to begin her presentation.
I apologize. Can you hear me?
Yes, we can.
Okay. I apologize. The lighting is changing in here minute by minute.
Yes. Thank you.
Try to block out some of my glare here. Let me go ahead and share my screen. Just one second. Piggyback a little bit off of what Annemarie shared about the things that are happening at UCSF, and just sort of try to encapsulate ways to move forward and ways to leverage the resources that the institution has at its disposal to enhance community collaborations, collective impact work, and to actually take action on some of these environmental exposures. But really, I'm going to talk more from the perspective of what is the function of the institution, how that may get in the way of really getting to the goal that we hope to achieve. I want to start out, I know Annemarie made reference to this, but I really like to just overemphasize the fact that if institutional behavior is untrustworthy, then the lack of trust that we often ascribe to community partners and communities that are disenfranchised or communities of color should be no surprise. And in fact, it's not a lack, it's an appropriate response to untrustworthy behavior. So I'm trying to, by that, sort of turn the lens inward and ask, what is it that we as institutions are doing to promote this division that keeps disparities and inequity alive? So I am the Associate Director for Community Engagement for the UCSF Helen Diller Family Comprehensive Cancer Center, which is similar to the Earth Center grant, is a large P30 grant. And the National Cancer Institute has effectively required that all NCI comprehensive cancer centers have a community engagement arm. And the community engagement activities are supposed to cover the catchment area of the cancer center. And so this map on the left is just showing you that our catchment area extends from the southern border of Monterey County all the way up to the Oregon border. My catchment area and coverage is of 48 counties, so I work with a number of different communities. And just keep that broad expanse in mind because there's a slide coming that will make this look kind of exaggerated in terms of our looking outward toward this, 2/3 of the state of California. The guidance that the NCI provides for how we should be working with community partners and addressing disparities across this large catchment area is that first that we need to provide a definition of the catchment area and describe the cancer burden. And I won't bore you with the details of how we came up with this gigantic catchment area. I'll just suffice it to say that the majority of our patients, 90% of them, come from this wide expanse because we are struck that we should do research to address the needs of the catchment area and then follow that by engaging the population. They want us to go on to address disparities, drive policy, and then extend what we're doing and our reach outside of our catchment area, which would be quite difficult. But what I want to focus on here is that they have step 3, engage the population, which I think is kind of hysterical, because in order to do research to address the needs of the catchment area, I think you have to engage the population first. And so this is a bit of a glimpse of sort of the rubric by which academic institutions think about community and think about addressing disparities. So it's research first, community next. Our community advisory board chair, Arnold Perkins, is just a wise man, and I put his picture there because it's so calming. And many of you probably know him. He's a former director of the Alameda County Public Health Department, and just a major champion for social justice, former member of SNCC, so a little bit radical too. And one of the things that he often says to me, as well as to the rest of the board, and tries to get across to my academic bosses, is that you can't teach what you don't know, and you can't lead where you won't go. So I've translated this in my own practice in terms of how I do engagement work into this concept of reaching out versus doing outreach. And I believe really, sincerely in the partnership that has evolved that Annemarie just described between our institutions, our different centers, and the Bayview Hunters Point community advocates, that it really is about showing up. So this is just a photo of Michelle Pierce at one of the first meetings of the Southeast Community Council, which came together around some of the most recent falsified reports of toxic contamination in Bayview Hunters Point. And I remember getting the invitation, and I thought to myself, I see all the big names from my academic institution invited to this event, and I really want to see who's willing to go there, because again, you can't teach what you don't know, and you absolutely cannot lead where you won't go. And I just put this map here on the right to illustrate how close our comprehensive cancer center is to Bayview Hunters Point and to the toxic contamination, and for the fact that we are built on the same sort of landfill, crummy excuse for bedrock as a lot of Hunters Point. And so whatever contamination is in the water or in the soil potentially has an impact on our cancer center as well. And I just kept thinking to myself, my address is in this building, it's on 3rd Street. And to be the cancer center on 3rd Street that ignores the cancers down 3rd Street would just be an absolute embarrassment, given that large catchment area I showed you. I mean, I could be working all the way up the Oregon border, but why shouldn't I be working just down the street? So when I attended the gathering, I started asking people, community members who were in attendance, just trying to drum up some conversation about what are the cancer concerns that are in the community, and also to find out whether or not they were aware of any of the cancer programming and community engagement work that our cancer center was professing to do. And I was just shocked by the fact that it took me about 5 to 10 minutes to drive down to the location. But nonetheless, many of the people who were there, who lived in the neighborhood, didn't really know what the cancer center was doing or what the cancer center was about. So again, just a major illustration of what would be our inability to impact in this community that absolutely has cancer concerns, and where we are required to be attending to the concerns in the catchment area, but that we were sort of absent and they're unaware of doing. It means that we're not being present enough to really have an impact. And I think that's simply a function of how academic institutions kind of roll. Another thing that Arnold often says is if you want a different outcome, you have to try something you've never done before. And what I would just remark about cancer disparities, a field in which I've been involved since 1993 as a medical student, where I work directly in the community with community-based organizations focused on African-American health, is that disparities, the gap in survival for different cancers have actually gotten worse over time. Although other populations have benefited from reduced incidence of cancer, reduced mortality from cancer, African-American populations and those who are uninsured or have low resources have experienced widening gaps, which suggests to me that everything we've been doing from 1993 forward, we are probably missing the mark. And if we continue to do things the way we have traditionally, it's unclear to me that we will make any impact or any difference. So this table just tries to illustrate sort of the technical approach which for the academic institution and how we conduct what we might even call community engaged research. Compared to a transformational approach where community leads. And again, this gets back to this idea of trying something that we've never done before, which is actually stepping back and letting community help us create the questions that are embedded in the context in which they've been living, the exposures that they are aware of, even the anecdotes, which we sort of poo-poo as simply not meeting the scientific rigor for investigation. But the reality is, folks who've been living in Hunters Point over the course of decades have observed things that we would, in the academic institution, would traditionally miss just because of the structure of the way we get promoted, the way grants are funded. You know, you get 5 years and then you're on to the next thing that NIH is interested in. And so just to highlight a couple of things in this comparison between our typical technical approach, one of the things that struck me is that the community had already been told about, in the assessment outcomes, the use of sort of cross-sectional data to measure the number of cancers that have occurred in Bayview, Hunters Point. And what was odd to me was that what my institution produced for the community was a snapshot of the years 2008 to 2012 and looked at the very, very common cancers, but didn't consider the fact that there are known exposures that you'll hear, more about in terms of the history of Bayview, Hunters Point, and taking those kinds of exposures into account and actually looking at those cancers over a longer period of time. So when you look at a snapshot of 2008 to 2012, you're going to find that, well, yeah, it looks like the number of cancers that developed in that time frame are about the same as the rest of the city or of the state, and nothing is abnormal. But again, we're looking in the wrong place, and we're looking because that's what we traditionally look at, is the top 5 incident cancers in a cross-sectional approach. The other thing is that we hold all the data, and I like to say we are a public institution, and I used to be at a private institution, so I couldn't say this as freely, but all of our research, including the Cancer Center, the Earth Center, everybody's federal grants are funded by taxpayer dollar. So why is it that we hold the data so close and keep it almost like we're holding it for ransom? That data should be shared, and we need for how we do that. So in the transformational approach, the community owns the data, and in the particular grant application, which was not funded, but that sort of brought a number of Cancer Center investigators, the Earth Center, some of the Earth Center investigators before it was the Earth Center, minutes before it was the Earth Center, and many community partners together, had embedded in it this concept that whatever data we collected, particularly biospecimens, that they would belong to the community, and that any use of those biospecimens would have to be evaluated by the community and permission given by the community to the investigator only after the investigator makes a presentation, answers questions, and has an interaction that allows the community to determine whether or not they want to work with that particular investigator. And then I think Annemarie kind of touched on some of these other pieces, like the bidirectional sharing of data, iterative interpretations of the results. But what you can see here is that there are two different agendas going on. The academic institution has an agenda that's about publication. It may not be about impact, because often our publications just sit in the PubMed and nobody reads them, sad to admit. Community agenda really is about action and systemic change and flipping of the status quo. And so again, back to Arnold's quote, you know, if you want a different outcome, you've got to be willing to try something you've never done before. And this transformational approach where community leads is really the place where I think we have an opportunity to have impact. We've been trying the technical approach, it's not working. So I'm just gonna end with a few slides, sort of my recommendations for what needs to happen in order to really have impact around environmental and social justice. First, we need transparency. And that means reducing cover-ups, admitting mistakes, and providing the background that helps folks understand why the mistakes were made and why actions were taken. And that's going to require some serious structural change inside the institution. We first have to deconstruct our concepts of academic supremacy, that we know everything and that we're the experts. And even inside the institution where we teach that if you make a mistake, something wrong with you, that we are somehow automatons, robots, and perfect. This leads to needing to cover things up in order to maintain that facade. We need to stop rewarding just good outcomes with publication, and actually stop ignoring bad outcomes by actually denying publication. We don't provide an opportunity to admit mistakes, learn from mistakes, retool, and come back with a new solution. And until those structural changes happen, again, we'll be doing the same thing over and over. So transparency is really key, especially in trying to build collaborations and partnerships with community. We need a translation arm, and I'm a little bit biased because my undergraduate degree is in linguistics. I speak a number of different languages, and I've trained in a number of different fields: basic science, health services research, clinical care, community engagement. And what I understand is that the bandwidth to speak a number of different dialects, it really changes the way that folks are able to engage. And unfortunately, inside our academic institutions, we teach one dialect. It is, you know, you are provider, you are scientist, you are smart, everybody else is needy or lacking or whatever. So we need to actually start to promote the ability to speak a number of different dialects, both inside and outside the institution, and then build teams that link from inside to outside. So through Michelle and the Southeast Community Council, to other organizations who are working on other aspects of health and health equity and disparities. So it's a chain. It's not necessarily folks that we can reach without our partners. So in order to make this happen, the institutions have to start to develop new metrics for promotion that account for cross collaboration and reward community engagement. Right now, that's sort of thought of as like, oh, it's an add-on and we'll get the community involved later after we develop it. We need to actually flip how we reward the development of community engagements. We need to also commit to longer term relationships and collective impact. What that means is it can't just be that one investigator who cares enough to be in the community, because then we're laying a systemic problem on an individual to fix. And when that individual leaves, the community sees that as the institution leaving. So what really needs to happen are institutional partnerships. So an office like mine, which is Office of Community Engagement, the Earth Center Community Engagement Corps, what we are looking to do is what we call year-round non-transactional community engagement. So we're around even if there's no project going on, there's no study to be involved with, but we're just maintaining the relationship so that when individual investigators do pop in and pop out, the institution is not seen as leaving. These relationships cannot rely on individual folks. Institutions need to start to reward high impact, action-oriented activities in the community just as much as they reward high impact publications in JAMA and New England Journal, because the work is equally hard, but has enduring outcomes. And then finally, just transformation, I think, is the word that I would then just really
everybody. And I do want to say that my presentation will be very, not quite repetitive. It's a different perspective, but everybody who's on this panel, obviously we all work very closely together and we are covering each other's work. So with that being said, let's go into my presentation around the challenges from the front line. And my presentation is really about building community academic collaborations in environmental justice. So as an organization whose main focus is building autonomy and independence for the residents in my community, why on earth would I need to collaborate when, as both Annemarie and Kim have suggested, there is no reason for us to trust anybody. And when we do try to trust people, our health suffers for it, right? So then why bother? Going back to within my community and environmental justice, particularly with this Hunters Point Naval Shipyard site, initially, the city and the US Department of Defense wanted to do a transfer of the land where this shipyard was. It was an active military base, by the way. They wanted to do this transfer so that the land could be developed for housing and other activities right along the shoreline, this beautiful high-end waterfront property. And so when the talks first started, the Navy claimed there was nothing going on within the community at all. There was no nuclear research. There was no contamination. The community who built themselves up around that shipyard, both before it was a military base and after it was a military base, said, no, we know what we were doing there. We don't know what you think we were doing there. After a lot of back and forth, all of a sudden the Navy found some papers in some retired captain's garage and said, oops, whoops, yeah, we had this extensive program going on for 40 years that we weren't even aware of, even though we shut the program down 5 years ago. So this is how the mistrust begins in the community. Now, in order for us to discover the paperwork that supposedly had been missing and the knowledge base that supposedly had been missing, of course we need to collaborate with people who are willing to be whistleblowers, people who had also been adversely affected, people who might want to buy the land, and people who could interpret the data, which brings me to my next point. So the environmental justice movement as a whole developed from a lot of communities, really disadvantaged communities, vulnerable communities, I would say overlooked communities more than that, or marginalized communities. They became disadvantaged and vulnerable because they were marginalized. Now, everybody knows about redlining these days. A lot of the communities we're talking about did not have necessarily the scientific sophistication to understand what was going on with these reports that we were getting in our various communities all across the United States. And when I say didn't have the scientific sophistication, I don't mean were uneducated or unaware. What you had was people who were sophisticated and highly educated but not necessarily in the hard sciences that the government wanted to speak to us in, or that corporations wanted to speak to us in. These are people who had the intellectual depth and curiosity to know what they did not know. And as most of you know, that's a really high bar, because most of us don't know it. These are people from the president of the PTA to executives at IBM. So they knew they needed people to come in who would listen to their concerns, who would translate it into tech speak and meta speak, as Dr. Rhoads just alluded to. And that's where these collaborations began. We also had, as I just alluded to, an extreme housing pressure in San Francisco, which we're talking about the late 80s, early 90s. This has become an extreme housing pressure first to the entire Bay Area and now to the entire state, right? So even those people who maybe 20, 30 years ago, 30 years ago would have wanted to get more knowledge on this stuff. Right now, they're like, no, we need to put some people in a house. We don't care. But guess what? Those of us who've been forced to live on top of this stuff, we care. And we think once you're forced to live on top of this stuff, you will care too. And so I have the early collaborations we had, the Bayview Hunters Point community advocates, as well as other nonprofit organizations working in the field of environmental justice. And they formed a collaborative called SAGE, the Southeast Alliance for Environmental Justice. Our early collaborations were first with UC Hastings and Golden Gate University, trying to prevent additional power generating plants coming into the neighborhood. At that point, this is the mid-90s, at that point, we already had the only 3 power generating plants in the whole city. And the city was voting, or the Board of Supervisors was voting to add yet another one. We collaborated successfully with UC Hastings and Golden Gate University by figuring out all of the polluters, not just the power plants that existed in our community, showing how close they were to each other and how close they were to our actual houses. And the fact that we did not have a whole lot of clean spaces in our communities that were free of pollution. And really, we began the conversation around cumulative impacts in the state of California with that work. We continue to work with Golden Gate University, again, not just the advocates, but all of the nonprofit environmental justice, social justice organizations in Bayview Hunters Point around the shipyard, around muni violations of regulations, around other polluters, cement plants, fat rendering plants, the water treatment plant. I mean, we can go on, as Annemarie stated earlier. And my fellow panelist, Daniel Hirsch, who got involved with our work and really has been both a strong ally for the work that we're doing and a strong advocate for us, and continues to be a very strong activist for communities such as ours that are impacted by the Navy shipyard. I will let him get into the technical aspects of our collaboration. But again, Daniel Hirsch has been partnering with, collaborating with, and working on behalf of various nonprofit organizations and community activists throughout our community and several other ones. Now, I removed naming names specifically, but I'll go into a couple of bad faith academic collaborators. And I'm happy to have Annemarie and Kim acknowledge that UCSF is one of those bad faith collaborators upon occasion. The first one is going to be UC Berkeley. Their Lawrence Lab has an air monitoring project which studies air quality throughout the United States, but specifically in highly vulnerable communities. The reason I say this is a bad faith academic collaboration is that the UC Berkeley research actually, it refuses to share the technology that it uses for air monitoring. It refuses to train community in that specific technology so we can understand what's going on. And let me tell you, our communities don't trust anything that we don't understand because we've been exploited too much. So that's a first sign of a bad faith collaboration. If you're not going to sit back and explain the technology to us, we have no reason to trust you. This particular project refuses to share the protocols or credit for the protocols when they do allow us to contribute. And they own the data outright. They refuse to share the data. All of these are bad faith collaborations in the view of environmental justice activists. Research should be transformative, not transactional, as Kim implied. And what this is truly turning us into nothing more than guinea pigs. You really want to question, what are you leaving behind when you come into a community? And that's how you get to transformational work. And that's the only kind of work that really effectively addresses disparities in communities. I also want to get to what both Dr. Rhoads and Annemarie alluded to, which is the Committee to Review Hunters Point Radiation Testing Protocols. And this was a collaborative between UC Berkeley, UCSF, our mayor's office, and our district supervisor. The problem with this specific report is that it was initiated to reassure community and potential buyers for the land that's being developed, that there was nothing to worry about with this particular development. So the reason this is a bad faith academic collaboration as far as community is concerned is, number one, this particular report was not allowed to state whether or not this site was safe. What was the main concern that you were trying to address towards community? How are you going to rebuild trust if you can't tell us if it's safe to live here or not? But that was specifically excluded from this project. Number two, community was not brought in to help set up the process, was not brought in to have a conversation. Community was allowed one listening session in which we were not really supposed to even have a conversation with. How are you going to address the mistrust when you are not allowed to find out even, much less discuss, the concerns or the needs of the community? Therefore, when the results of the report came back, why on earth should we trust those results? They didn't tell us, number one, what we wanted to know. They didn't tell us, number two, why the protocols for testing the area were deemed insufficient and then changed. And number three, no one was allowed to talk to us. This is a community that works based on relationships, and there was never a relationship allowed to develop. So I'm hoping this sticks in your head as I lead into my next slide of what not to do going forward. Best collaboration practices. All of this was covered more in depth by Dr. Rhoads, but I really want to emphasize it from a community perspective. These are the things you need to do if you really want to engage meaningfully with community, if you want to get high quality data and information with community, and if you ever plan on coming back, these are your basics. These are your starting points. This is not the end all, but these boxes better be checked when it's time to actually get the work done. Number one, you have to have community involved in the project from the very beginning. So from design of research, from design of the research questions, to design of the protocols, design of the algorithms for data analysis, to the communication strategy of your results when the project is done. Community needs to be there from the cradle to the grave, no exception. Number two, community needs to be in the lead, because I can guarantee you, if community is not in the lead or co-lead, whatever research questions you guys come up with are not going to be sufficient, even for your own research. You need to understand the history, you need to understand the interactions, and you need to develop the relationships in order to really engage with environmental justice communities, period. Non-negotiable. Number three, all parties' roles in any multi-party collaboration need to be defined before the work even begins. And I'm saying this because there is no faith and no trust in any kind of human research in communities that have already been exploited if we don't know who's doing what, when. And when I say this, I need to stress that these are the opportunities to draw clear boundaries, and clear boundaries need to be drawn, and those lines need to never, ever, ever be crossed. This really is a building from the ground up on every single collaboration, even if it's with groups, organizations, labs, or people that we have already worked with. Every single time you have to start from the bottom, because the trust is never going to be there if you don't. Number four, and following my last statement, you really have to agree ahead of time on what your process is going to be for conflict resolution. And you have to build into that process an off-ramp for the project that can leave the project, well, you know, you'll be scrapping the project, but you need to leave on, if not friendly terms, at least understanding terms. And without these practices, there's just no way that community will ever buy, believe, trust any of the information that comes out of any of the research. So these are the ground rules. Don't step up and engage unless you can and will do these things. And there's a lot of institutional education that has to go on in these collaborations to really move the needle towards these best practices as standard operating for institutions, from the bottom of the institution all the way up to the chancellors and presidents and all of the steps in between. You really have to be committed to re-educating and refocusing how the research happens. And I cannot think of a better person to explain those collaborations than the next panelist, Daniel Hirsch. Thank you very much, everybody.
Thanks, Michelle. And that's a great segue to Dr. Daniel Hirsch, who'll be our final speaker.
Hi, can you hear me?
Yes, we can.
And can you see the slides?
Yes.
Okay, thank you so much. So, 3/4 of a century ago, On July 16th, 1945, the USS Indianapolis departed Hunters Point Naval Shipyard carrying components of a bomb codenamed Little Boy, including half of the highly enriched uranium then in existence in the world. It was headed to Tinian Island. Excuse me, the host says they want me to start my video. I ignore that. Can you hear me?
Yes, I think you can ignore that. Your video is
Okay,
working.
sorry about it. So that shipment of that bomb went to Tinian Island in the Pacific. And on August 6th, the Enola Gay left Tinian and dropped the assembled atomic bomb on Hiroshima. Less than a year later, some of that impact of the arms race that was started came back to Hunters Point. There were nuclear tests in the Pacific, the Operation Crossroads test in the Bikini Atoll. The test went awry and badly contaminated hundreds of ships.
Tom, can I, excuse me, Dan, can I interrupt you for just a second?
Please, sir.
If you'll turn on your video, we'll be able to see you as well as your slides. I think that's what the nudge was about.
Okay, so let me try to do that.
Just on where it's your video looks like it's off, just.
Uranium tamper, and on the inside then either uranium or plutonium core. And when those bombs go off, they distribute large amounts of unfissioned plutonium and uranium, scores of fission products, the products when the uranium or plutonium split apart, and what they had forgotten about at Bikini, activation products from neutron irradiation of materials like sand and sediment. So they did it in the middle of the atoll. It tossed high into the air large amounts of radioactivity, which came down on the ships. They tried desperately to decontaminate the ships. Here you see sailors with no protective equipment at all, scrubbing the decks with brooms, hoses, and soap, trying to get the radioactivity off, which they completely failed at doing. So the Navy decided to take 79 of those irradiated Crossroads ships to Hunters Point for decontamination. And over the subsequent years with other nuclear tests, additional ships were brought to Hunters Point. Hunters Point, as we've said now many times, is historically a community of color, low income, as it is still today. So the ships were brought back and they were sandblasted in the open air, where the radioactivity was removed from the ships, but simply transferred from the ships to Hunters Point. They also had the Naval Radiological Defense Laboratory there, which did extensive work with large quantities of radionuclides. Their licensed radioactive inventory, they had much more than this, not licensed, included 60,000 curies of strontium-90, yttrium-90, 15,000 curies of cobalt-60, 30,000 curies of cesium-137. And we measure permissible concentrations in the environment in picocuries, millionths of a millionth of a curie. They had 2,000 grams of plutonium-239. To put all that in perspective, 60,000 curies of strontium-90 could contaminate more than 10 trillion tons of soil at EPA's default superfund remediation goals. And I'm sure you all remember that for plutonium, a millionth of an ounce, if inhaled, will cause cancer with a virtual 100% statistical certainty. That widespread radioactive and toxic chemical contamination made Hunters Point a Superfund site. And it was placed on the national priority list in 1989. But the cleanup has unfortunately been absolutely a scandal. This letter is one of the most amazing government letters I've ever read. And by the way, EPA didn't release it publicly or voluntarily. We had to get it through the Freedom of Information Act. EPA and two other agencies found signs of potential falsification, data manipulation, and data quality concerns that call into question the reliability of soil data in 90% of the survey units in Parcel B and 97% of survey units in Parcel G. I've been doing this work for half a century. I've never seen a table like this before. In only 3% of the survey units in Parcel G were there no signs of falsification found in the data. For parcel B, and only 10% where there are no signs of falsification. And again, for these other parcels, in only 3%. Absolutely astonishing. But this is for the portions that they measured. 90% of Hunters Point was never sampled at all. They just declared it couldn't possibly be contaminated and didn't check. On top of that, for the few places they did check, they simply ignored 90% of the radionuclides of concern. There are more than 30 radionuclides of concern at Hunters Point, but they only measured for 3 or 4. On top of that, the cleanup goals are extremely outdated and inconsistent with EPA's Superfund guidance. This is buried in the back of a key document, the 2006 cleanup goals. And these are the same goals that they continue to use today in 2020. And you can see that they got the cleanup goals from an EPA document from 1991 and the cleanup goals for buildings from an Atomic Energy Commission document from 1974. The AC hasn't existed since that time. Buried at the bottom in footnotes, and you all remember I.F. Stone's great statements as to how to read a government document. Read it from the back to the front, because that's where they bury the important stuff, and read the footnotes. This is why this community and other communities need your help, technical assistance, to discover what's buried in the footnotes, using standards from 1974. We compared the cleanup standards being used by the Navy now at Hunters Point with the EPA default preliminary remediation goals. And for plutonium, radium, and thorium, they are hundreds of times weaker, unbelievably lax standards that should never, ever have been approved. So I told you that the cleanup has been halted in large measure because of the scandal involving Tetra Tech, the Navy contractor, fabricating measurements. They would find contamination in the sample, throw it out and replace it with a clean sample from somewhere else so the Navy could spend less money on cleanup. The problem is that the retesting has many of the same problems as the original fabricated measurements. Here's just one. They're inflating background. You need to know what would have been at Hunters Point if they never contaminated it, so you can know what they don't have to clean up. Anything above background and above a cleanup level, you're supposed to clean up, but they're inflating the background. Here are 4 background locations that they are using. And you'll notice that they are all in the midst of the contaminated Superfund site. Clearly, where the control sample is being skewed, pushing the number up to push the cleanup down. On top of that, the Navy discovered that there was a lot more contamination at Hunters Point than they thought, so they reversed their original cleanup promise, which was to remove the contaminated soil, and replaced it with a plan that the majority of contamination will be simply left in place on site beneath a thin soil or asphalt cover. Rather than cleaning it up, they're going to cover it up. But of course, development of the site will require tearing up the covers and the contaminated soil beneath them. I want to remind you that what's planned for this site is the largest redevelopment program in San Francisco history since the 1906 earthquake. And there's a huge amount of money involved. Lennar Corporation, which is the developer, is the largest developer in the country and provides lots of campaign contributions in San Francisco. This breach of promises violates the community acceptance criterion of Superfund because the public passed Prop P years ago calling for the site to be cleaned up to the most protective standards without covering up the contamination, and that's being violated. So the question is, are there any models for community-directed oversight that might be helpful for Hunters Point? So we're going to turn our attention for a moment to a site several hundred miles to the south, the Santa Susana Field Laboratory. It is surrounded by approximately 500,000 people living within 10 miles. It was established in the late 40s for rocket testing and Atomic Energy Commission nuclear reactor work. In 1979, while teaching at UCLA, my students uncovered documents that there had been a partial nuclear meltdown at the Santa Susana Field Lab that had been kept secret for 20 years until my students uncovered the documents. Here's a picture of some of the melted fuel, another photo of some of the melted fuel. There were no containment structures for this reactor or any of the other ones there, so the radioactivity was just vented directly out into the environment. At least 3 other reactors suffered accidents. There were radioactive fires at the hot lab where irradiated nuclear fuel from around the DOE complex, AEC complex were shipped in from around the country. There were releases from the plutonium fuel fabrication facility. Here is a photo showing some of the 10 nuclear reactors that operated at the site, as well as the hot lab that had the radioactive fires and the plutonium building. On top of that, there were over 30,000 rocket engine tests and tests of missiles for the nuclear program, often releasing toxic materials from the exotic fuels that were being used. And on top of that, they found it cheaper to dispose of toxic and radioactive materials by simply igniting them in open air pits on site. They did that by shooting at them with rifles, with the toxic cloud spreading widely, not only over the site, but over the communities nearby. So the community wanted to get that site cleaned up. They wanted to know if there were health risks from the site, and they didn't trust the agencies. So there were 4 community-directed oversight efforts that might be relevant to Hunter's point. The first is that there's an inherent conflict of interest in a troubled history involving having studies of potential harm from contamination that is caused by the government, having those studies being performed by the government itself. There's often substantial public distrust based on years of government agencies, frankly, lying to the public about the health risks. So the alternative model, the one we used at Santa Susana, was an independently overseen health study. The epidemiological oversight panel was established, which consisted of independent experts that the community trusted, as well as community members. It's a really extraordinary model. It selected and oversaw a team from the UCLA School of Public Health to perform the studies. Here are some of the members of the panel. You see that my co-chair was Jack Geiger, past president of PSR. It included Alice Stewart, the most eminent and independent radiation epidemiologist in the world, who had done the 1950s Oxford cancer childhood study, showing that irradiating pregnant women caused cancer in the offspring. A number of others, including community members. What they found was that the exposure of the workers to radiation was associated with elevated rates of dying from cancers of the blood and lymph system and from lung cancer. The death rates for all cancers were found to increase monotonically with dose. Similar problem from internal radiation. The most exposed workers had triple the death rates for those cancers as the least exposed workers. Interestingly, these cancer impacts occurred at doses well below the doses permitted by current regulations, and cancer risk per unit of radiation dose were about 6 to 8 times higher than those generally used in establishing radiation standards. They found similar findings for the workers exposed to chemicals from the rocket testing. So then there were offsite studies. These were funded by ATSDR, but were overseen independently. The health study offsite done by Dr. Hal Morgenstern found that the incidence of cancer was more than 60% greater among residents living within 2 miles of the site than among residents living more than 5 miles from the site for cancers of the thyroid gland, upper aerodigestive tract, bladder, and blood and lymph tissue. There then were a study done by Professor Yoram Cohen from UCLA on offsite exposures that found contamination had migrated to offsite areas at concentrations in excess of EPA's levels of concern. Second model, the SSFL work group, established 30 years ago to keep the community informed about the contamination at the site and to assure its thorough cleanup by holding the agencies and responsible parties accountable. It included all the key agencies as well as community representatives, some of whom were technical experts. So the community had its own technical muscle. And these technical experts helped the community translate the information put forth by the agency representatives into common language. Often agencies, in their effort to try to dissemble, frankly, try to use very complicated terms when if you translated it, the public would be extraordinarily upset by what they were hearing. And the independent experts helped challenge questionable agency assertions in the meetings. The community residents made very valuable contributions because they knew where local dump sites were, they knew about which way the winds were blowing, all sorts of matters that were very helpful. Here's just an example of one of the panels at one of the work groups. The man on the left is John Pace, who you saw in an earlier photograph during the meltdown. Here he's telling the public what he experienced while that accident was going on. The man to his right was present after the meltdown and was sent in to help clean up in a pretty botched cleanup, which he was describing. To his right is Bonnie Klee, who was a worker at the site, developed cancer, and has been extraordinarily energetic in getting compensation, government program to compensate the exposed workers. And then to their right, you see Bob Dodge and Denise Duffield from PSRLA. Third model, community-advised EPA radiation survey. Just like at Hunters Point, there was distrust of the measurements made by the responsible parties. Tetra Tech fabricated measurements at Hunters Point, and the measurements made by Boeing and his predecessors similarly were skewed. And so the community insisted on independent measurements. California senators arranged federal funding, but made sure that the responsible parties didn't get the money to be able to do the measurements. EPA did the measurements, but guided by a community panel, met monthly to give direction to the EPA study. The study found every 7th soil sample taken had radioactive contamination. Of the 3,700 samples taken, 500 showed contamination as high as 1,000 times background. And lastly, independent technical assistance to the community. So the problem is that the entities that pollute a site and have a financial incentive to avoid cleanup obligations, and the regulatory agencies that are captured by those polluters have large numbers of well-paid technical staff to argue on behalf of weakened cleanup requirements. The community needs technical people on their side to level the playing field and protect their interests. Here's a tiny example of why that independent technical assistance, and I'm going to twist the arm of those of you listening to see if some of you are willing to help Hunters Point in the same way. Here is page 2877 and 78 in a several thousand page document, one of a dozen or so submitted by the Boeing company to the state. You see that you need a magnifying glass to read the numbers, and the conclusions in this are left out of the executive summary at the beginning of the report. I've blown up that one number, and all of you who spend your lives with exponentials will find your jaw dropping. The Boeing estimate of the cancer risk on this part of their property is 9.6 times 10 to the minus 1. If 100 people lived on that part of Santa Susana, Boeing, not me, Boeing is saying 96 of the 100 would get cancer from their exposures. Buried in the report, they say that the estimated lifetime cancer risk is greater than 9 times 10 to the minus 1, which is above the EPA target risk range of 10 to the minus 6 to 10 to the minus 4, above, orders of magnitude above. And yet it isn't getting cleaned up. Having independent experts help the community read these reports, discover what's going on, led to a breakthrough finally in 2010. The Department of Toxic Substances Control and DOE, the Department of Energy and NASA, signed legally binding agreements requiring cleanup to background, meaning to restore the site to the condition it was in before being contaminated. DTSC said it would also require a comparable level of cleanup for Boeing's part of the property. So I've given you some examples that may be useful for Hunters Point, and now I have to be candid and tell you that this struggle in Santa Susana has not been won. Despite the legally binding agreement, the administrative orders on consent, which required full cleanup by 2017, it's now nearing the end of 2020, and the promised soil cleanup hasn't even begun. And just 10 days ago, the Trump administration issued a record decision saying it was going to break the cleanup agreement and instead leave the great majority of its contaminated soil not cleaned up. Conclusion. These battles on behalf of impacted communities are tough but critical. There's a huge imbalance in power between those who pollute communities and those who are placed at risk by that pollution. What is essential is to redress that imbalance, in part by public health professionals providing their technical expertise to those communities in the battles for environmental justice. The fundamental question is, will you help? The only way to help impacted communities protect their health is if people with a combination of technical knowledge and conscience, I want to repeat that, the combination of technical knowledge and conscience, come to the aid of these communities. The nuclear arms race set sail from Hunters Point 75 years ago, and some of its radioactive residue returned beginning a year later and still hasn't been cleaned up. That impacted community needs our help. Thank you.
Thank you, Dan. That's a sobering presentation to end our presentations, and challenging and thought-provoking. I'm going to ask each of the panelists now to turn your videos back on so that our participants can see you. And to our participants, you're invited now to post questions in the chat to one or all of the panelists or a group of the panelists, and we'll try and get through as many of the questions as we can. So Dan, I think the first question is for you. I don't know if you can see the chat, but Tom Newman is asking, what does legally binding mean in the context of cleanup agreements?
So the agreement signed between the federal and state governments is a contract, and it is something you can't avoid. It is legally required. But the footnote in the damn document is it can only be enforced by the parties who signed it. So right now, the Newsom administration, which makes all sorts of noise about holding the Trump administration's feet to the fire on environmental matters, has quietly been allowing the Trump administration to break this agreement. So it is legally binding, but it requires the Newsom administration to enforce it.
Okay, I think we're probably not surprised by that, but it's still disappointing. We've got another question. Do the homes over the contamination have to be removed? I guess that might be to you, Dan, and I see Michelle shaking her head. So either one of you want to chime in, or anybody else who knows the answer to that question?
So it's a very complicated question. It depends house by house and what's underneath the house. For example, if you have some radium under the house, you're going to have the potential for a significant dose to, let's say, a child in a bedroom, but more particularly, you have radon gas coming off from the radium. So it infiltrates into the house. If it's just radon gas, you can then put in a system to try to expel the gas, but it really depends house by house. The larger problem is that there is this huge area of the shipyard itself that they want to put houses on without cleaning it up.
And then a question again to you, Dan. Why isn't Newsom on board with the cleanup, or is Newsom on board with the cleanup?
So this is a painful matter for me. Newsom's Secretary of Cal EPA is Jared Blumenfeld, who was the EPA Region 9 administrator before that. And he and Governor Newsom made all sorts of marvelous statements about their commitment to the cleanup. But in the last months, that's completely fallen apart. They appear to be quietly attempting to cut a deal with the Boeing company, one of the three responsible parties. So it's the traditional thing of politics, which is that there are powerful entities who can make campaign contributions, hire former Cal EPA secretaries to lobby current Cal EPA secretaries. And the parents of kids who end up with pediatric cancers can't hire a lobbyist like that. They don't make those campaign contributions. So we want it to be black and white, that it's the evil Trump administration and the good California Democrat. But I'm afraid there's a fair amount of blame that can go quite a distance.
We have another question in the chat, but Michelle, I wanted to ask you a question as well, just about the community groups in the neighborhood. So who are the community groups besides your own that you work with around this issue? And can you tell us a little bit more about how community groups have been organizing, allied by some of the other folks on the panel?
So I have to be honest with you guys in that I try to avoid the shipyard as much as possible because dealing with all the players involved is like voluntarily banging your head into a brick wall repeatedly. I've chose to stop banging my head into that brick wall. what we have done is gathered all the documents, because when we're in the rooms together, the Navy uses one set of documents, the city uses a different set of documents, and the community uses their own documents. All are, from each of our standpoints, legitimate. A lot of times they contradict each other. We're all working with different sets of data. And so one of the reasons we created the documents library is so we could all have the same information in one place that we could all look up. Truthfully, right now you have the residents that are fence line that are not actually on Hunters Point, but whose housing has always been fence line to the shipyard itself. There's a lot of public housing right there on that fence. There are cooperative condominiums and townhouses on that fence line. There are some really fancy, pretty new houses that are being thrown up at market rate that are not technically on the shipyard, but they, even though they're market rate, they sit on land that used to be public housing land that is directly on that fence line. All of those groups and those residents are coming together and showing up at these meetings, particularly the Bayview Hunters Point mothers and fathers. You have longtime environmental justice groups like Green Action. You have the residents of Treasure Island who are following this closely, because basically where they are is the inheritors of the activities that were happening at the shipyard once the shipyard was closed. You have the Nation of Islam, who still has a fence line preschool that is very close, who have been repeatedly lied to about the safety of that location. Man, there's a lot of churches who have been active. A lot of these organizations were founded by and run by people who have been, particularly in the last decade, dying off. Understandably, we're active out in this truly compromised land. And so a lot of these organizations are either no longer in existence or reformulated around other issues. So that, I mean, that there is a whole universe of people who are concerned, but really the entire neighborhood, not just the shipyard, is compromised land. And there's so much work to be done that a lot of us simply show up when it seems like there's a crisis, when people are reaching out to us and saying, you need to be at this meeting, because we need to rally around environmental health everywhere in our neighborhood. And we need to make sure people are housed and fed and taken care of everywhere in the neighborhood. So that's my mea culpa. This is not my baby. This is not the sword I want to die on. This is the area I will not let city, state, or federal government get out of dealing with without some accountability. So I show up when the accountability really needs to be felt and heard. And that's the best I can say. I mean, PSR has been there from the beginning on this issue, as has everybody else in the universe that has been described by Dan. It's very broad. What's scary is the number of people who are tracking this, who are shocked and disgusted and scared and confused by this process, and still we're stuck with it. I get contacted by people in the Midwest and in New England who are like, what the hell is going on here? San Francisco was supposed to be our model for planning, and this sounds crazy. And I all of the people who are on the other side from me, I beg them to explain to me how this is not crazy, because I would like to have the sanity explained to me on this project.
Yeah, I think Dan summed it up well, the unequal influence on one side of the equation. I'm gonna jump back into some of the questions in the chat. Let's see, does anyone have an estimate of the cost of the full cleanup to acceptable standards? Does anyone?
So it would be in excess of $1 billion, but I want to remind you that they wasted something on the order of $300 million on the fabricated measurements that they now have to redo. So it's that old business, you know, it's a lot cheaper to not have polluted in the first place. Once you get the toothpaste out of the tube, it's very hard to put it back in. But once you've got it out and you promise to do a good cleanup, you need to do it, because if you don't, and you put people on top of it, A, they'll start getting sick, and B, you'll probably have to go back and clean it up a second time, which will be much more expensive.
Thank you. And then another question is, have there been any class action lawsuits to compensate residents, and have these depended on demonstrating excess cancer incidents or other medical burdens?
So there was one that just was settled. I was responding in the chat if you guys want a little bit clearer information, but there was one that was just settled. It's for current residents on the site. There is one that is pending that is those fence line community members I was talking about. The cost to go up against the Department of Defense, and in particular the Department of the Navy, is incredible. Like you're literally talking about the most pre-Trump, the most powerful branches of the US government in the Department of Defense, and particularly the Department of the Navy is even stronger than the DoD within the DoD. So the amount of money and time, and in particular, if you have one of these really weird, really rare cancers that no one really understands anyway, trying to take that into a legal form is just, like I said, when you're going up against the government and multi-billion-dollar corporations, it's a pretty phenomenal task. So that, I mean, that's the best I can say, is this is years long. We'll probably end up each getting 50 cents.
Mm-hmm. Well, we're hoping you do better than that, and we're hoping that we can help you with that. Another question in the chat is there a study of planned cancer prevalence or incidence in Hunters Point? Can anyone answer that?
So the San Francisco Department of Public Health, which has been widely criticized for its conduct regarding Hunters Point, seems to be more of a cheerleader for the developer than a protector of the public from risks, did a quick and dirty review through the cancer registry. And it was like 3-4 pages, and it's just absolutely staggering what they did. For most cancer sites, they found an elevated cancer incidence rate. And then they went ahead and said it wasn't statistically significant. And then they went ahead and said, therefore, we've made a finding that there is no increased cancer, with the exception of lung cancer for males, which was statistically significant. So, I mean, that's the kind of quick and dirty thing if you want a certain result. There has not been a kind of study that you would do to try to determine the impacts of the shipyard on the community. And as I've indicated, you would want to do that as a community-based, community-directed study that is done by independent experts, and that hasn't happened.
Mm.
I want to add a little something to that, because I do think it gives a slightly false impression that the numbers may be high. The problem is the calculating a rate, and where they actually went wrong in what Dan is referring to is that they took the snapshot in time. That was the study that I referred to during my presentation, of looking at 2008 to 2012. So your numbers in a specific geographic area that is like defined, for example, by a zip code is going to be too small to calculate a reliable rate, which is why they will then tell you why the result is that it's not statistically different. But the real issue is, why are we continuing to look at the same cancers over and over and over again? Why are we not looking at specific cancers that we know are associated with specific kinds of exposures, and then comparing that, even if the numbers are small, to the incidence or prevalence of those cancers across just San Francisco, right? So I think it's more of asking a generic question rather than asking a targeted question. And I think, you know, in our conversations with Annemarie and other investigators in the Cancer Center and Michelle, and trying to get some of our activities funded, that is one of the primary aims of what we're intending to do using the Cancer Registry, because it does go back to 1972. The Bay Area. So we have an opportunity to look longitudinally and to really ask targeted and focused questions about the association between specific exposures and specific types of cancers. That, for example, that report could have included looking at any number of different types of liquid tumors, leukemias, and lymphomas, and it didn't, which I think is odd given that we're dealing with radiation exposure.
Thank you for that. Kim, while you have the spotlight, I wanted to just make sure that you had the chance to say all you wanted to say, as you were cut off right at the end of your presentation. And if there was if there was a point that you wanted a kind of a summary point that you had wanted to share in terms of your presentation. You don't have to, but I just thought it'd be a good opportunity.
Well, just quickly, the last bullet was just the last couple bullets about structural change were about taking off the deficit lenses and stopping and trying to avoid seeing community as just being in need. And that kind of goes with the outreach issue, is failing to see the assets that are already in the community. Because if you go with a deficit lens, the assets will be sitting right in front of your face and you will never see them. And what that requires is a bit of humility. So the last bullet was some humility that institutions need to just step back and just have a dose of humility.
Thank you. Thank you. That's a good reminder. We could all use a little more. Michelle, the last question we have might go best to you. It's a question about, has the distrust of institutions and medical and research authorities had an impact on the response to COVID-19?
Yes. Yes, but as I stated in answering that question, do you guys trust what's coming out of the Fed on COVID-19 or the city government? I mean, we haven't had a consistent message yet, right? Coming from official channels. So yeah, but it's not just the historical situation. It's the fact that they can't get their stuff together anyway. I will say that watching the crazy back in February and March means that a lot of us in the community did a lot of grassroots organizing. The community trusts us, even if they don't trust the official line, the government, the medical institutions or whatever. So we did an awful lot of educating, of testing, of PPE distribution, of monitoring. I actually would prefer to kick that question to Kim, because she's been on the sidewalks right along with me. And I can tell you that I think between the two of her, we're averaging about 20 hours awake and 4 hours of sleep on a good day. So yeah, because Kim, I said, the last I knew, our communities were actually testing at around 1% positive rates for every test. And I hope that still holds, because when we get this, we die. So we need to keep those infection rates really, really low. And the only way for us to do that is if we, the people, are out there making sure that that happens. So Kim, I'll pass that to you.
Kim, did you want to say anything in response?
I agree with everything Michelle just mentioned. We did do some work together trying to increase testing in District 10, which we think had a positive impact in terms of changing some attitudes around testing and increasing testing at the sites, the DPH clinic sites that were already available. It was after really the community coming together to advocate for testing on the street, you know, pop-up type testing in neighborhoods and communities, which again reflects on our, I would say my office's team's willingness to be in the community on the ground, not just be sort of dictating, you know, what needs to happen from inside the institution. And that I think is moving the agenda, particularly for African-American communities across the Bay Area. You know, what I learned from working in District 10 and in the Southeast sector and bringing that over to Alameda County and doing some similar work. So, you know, it is a disease where our rates of infection are low. You didn't see a lot of news coverage of that. I think people were disappointed when we tested some 400 African-American residents in District 10 and had 0 positive tests. Nobody wanted to cover that story. But the reality is that nobody is coming for us. And so it really is about community taking care of community. And that was just really a spin-off of the relationship that Michelle and some other community-based organizations that we had worked with came together and extended what we were doing around cancer into like, okay, now what is the current concern? Again, getting to this idea of year-round, non-transactional community engagement, being there all the time, regardless of what the issues are.
Very powerful. We have about 1 minute left, so I'm going to go through each of the speakers, the other speakers, and ask you to just share a sentence or two about what you want this audience of primarily health professionals and health advocates and other folks as well, but what you want them to know, learn, do about being Annemarie, can we start with you?
Sure. I'm hoping that people who participated tonight really see that there are so many opportunities to get involved and bring your expertise to the issues we're talking about. You know, things don't happen miraculously overnight, but they happen, and it's step by step, and it's building relationships, and it's just saying, yes, I want to be involved. And I would hope that at the end of tonight, you could see that there are many opportunities for you to, that you're needed. And if I can help facilitate connections in my role of the Earth Center Community Engagement Director, I'm glad to do that. But I appreciate you giving us this forum to talk about things.
Thank you. Dan?
One of the questions that was asked that we haven't had a chance to answer is, what should PSR do next? So my answer is really direct to you. This community needs your help. PSR should establish a committee of your public health professionals to assist this community to review the documents that the Navy puts out, the EPA puts out, provide independent assessment, some honest answers, and be a force to fight back against this effort to walk away from the contamination. You've dedicated your lives to dealing with the arms race and the impacts of the arms race, and this is an impacted community, and they need your help, and it would be concrete work, and I'd be pleased to help you with it. But if there were a committee at PSR that's going to try to review those documents and be able to help the community on the technical side, it would make a very major concrete assistance to people who need it.
Thank you for being direct. We need that kind of kick in the pants. And Michelle Pierce, Dr. Rhoads, I'm going to take your last statement as your kind of summary. So if we can end with Michelle, we've got just about 30 seconds, which do we,
So
what would you want us to know?
I feel that my recent catchphrase is remove your ego. And I use it both on the academic side and on the community side. If you're so caught up in being right, as Dr. Rhoads said, you're never going to get to an actual solution, particularly for a problem that's been around for 40, 50 years. So you have to take your ego out of it, and really focus in on what the question is and what the goals and objectives are, which is a clean, safe, and healthy environment. And you really do. You have to take the ego out. You can't be the expert on someone else's lived experience. They're the expert. They're living it.
Well, thank you. And that's a powerful last word about being a good ally practicing cultural humility. Thanks to all of the panelists. I've learned a lot, and particularly Dan, we're going to take up your challenge and talk with our board and our other committees about thinking about how we can focus directly on Bayview Hunters Point and practice what we've been saying. So thank you all for joining us in the audience, and thanks to all of our panelists, and good night all.